there, welcome to Talk to Me Tuesday on a Tuesday. I'm your host, Mighty B, and today I have a very special guest, Dr. Sammy Tao from Texas Regional Health and Wellness. Welcome.
Thank you for having me.
Absolutely, such a pleasure to have you. We're going to talk a little bit more about what it is that you do, what type of doctor you are, what is Texas Regional Health and Wellness. We'll get to that here in a second. So I want to invite all of you guys, thank you for tuning in to Talk to Me Tuesday on a Tuesday. Make sure that you guys don't forget opening up those lines of communication for the doctor. If you guys have any type of questions, either spine or health or wellness, nutrition, anything that you guys would like to ask that the doctor can answer, he'll be on the show today to answer those questions live. So let's introduce yourself, Dr. Sammy Tao, a little bit about yourself. Where are you from? How long have you been in practice?
Absolutely, I appreciate it. Thank you.
Yeah.
I'm Dr. Tao. I'm one of the providers at Texas Regional Health. We're a multi-specialty medical clinic. What we do is that we want to help as many people as we can through health and wellness. So I've been a chiropractic doctor for 18 years, so treat a lot of back pain that's related to musculoskeletal issues. But in my 18 years of treating, I just noticed my patients are getting worse and worse and more difficult to treat every year. The reason they're getting more difficult to treat is because they're no longer just a simple back pain. They're complicated by overweight issues, unmanaged blood sugar, thyroid is off whack, and other related health issues. So for managing their health-related issues that related to pain makes it really, really difficult to treat just because there are other issues with it. So what the goal of that is, all of us got together, formulate a Texas Regional Health and Wellness. Wow. So our goal with different specialty handles everything all in one place for a particular patient. So a patient can come in to see us for back pain, but we can also help them manage their blood sugar if something that they have questions about. We also can help them manage weight. So for example, if you're 50 to 70 or 100 pounds overweight, your back is going to hurt.
Yeah.
Right? So, and I don't care how great of a doctor you saw, doesn't matter what kind of specialty he is and how great of a doctor he is, he can only do something temporarily, because unless you lose that weight, it's not going to get better.
Right.
So wouldn't it be great if I have providers in our office that can help you lose weight and teach you how to eat right?
Absolutely.
So we can get you to get out of pain and losing weight at the same time. So that's just one of the examples that we handle at Texas Regional Health.
That's awesome. It sounds like a one-stop shop. Like you go in there for one thing and you might find out the doctor there's other things which, hey, you can address those things and help. And it might be something else that's causing it, like a nutrition, which you guys can help. That's awesome that you guys can do a one-stop shop. So tell our viewers right now exactly where you're located or what is your future plans too.
All right. So we're currently, our main office is in Sugarland/Missouri City, and we have a 4,800 square foot facility that takes care of a variety of problems. And our goal is to put neighborhood clinics in where people live, so we become accessible to everybody with health issues. They don't have to travel very far. So as a part of the goal in mind is we are expanding further into Pearland, and also into Chinatown area, because I speak Mandarin.
Nice.
So there's a lot of people in the Chinese community need my help because I speak the language.
Yeah, and that's awesome too. If any of you guys are watching that speak Mandarin, I know, so is that the only language you speak besides English? Okay.
But we have people who speak Spanish in our office.
Okay.
We have another provider who speaks Vietnamese.
Okay.
And we have another person probably coming on board. She speaks Russian.
Wow.
So we're trying to be variety just because of the fact that everybody has a different language that they may be speaking. So we want to make them feel at home, so they can speak their native language and get the healthcare they need.
Yeah, that's definitely diversity for sure. I know we talked about a little bit before the show, you've been on different shows as well, even in the community, so that you can speak to them. So you've gotten on the show and spoke Mandarin and really communicated and educated that demographic as well.
Right. So I appear regularly in the Chinese TV shows.
Awesome.
In the Houston area to talk about health and wellness. Most of the questions that I get still pain related, because 80% of Americans in our society do have back pain. So that's the most common questions with the opiate crisis that we have right now. A lot of people still ask, how can I get rid of my back pain or manage my back pain without getting on heavy or addictive medication. So those are things I speak most. Then I get really difficult health related issues, regards to their thyroid malfunctioning or digestive malfunctioning. So I help them from a nutritional point of view and things like that. I believe you are responsible for your body. So there's no way that your body can be healthy if your lifestyle doesn't permit healthy lifestyle.
Yes.
Yeah.
Yes. I mean, we're getting close to the end of the year, and then beginning of the year is coming up, which is a great time to reset yourself and reset that lifestyle. I mean, we're here with Dr. Sammy Tao, kind of speaking about more the nutritional facts, but also there's other things. You guys might come in for back pain. So if you guys know this celebrity, make sure you hit the like button, right? Since he's been on several different shows. Show the love to Dr. Sammy Tao. So I know let's talk a little bit more about your business. So what type of doctors do you have encompassing in Texas Regional Health and Wellness? Is it only nutritionists? Do you have any chiropractors, any medical doctors? What is your provider setup?
We have quite a few different specialty, if you want to call it. We start off with general medicine. So we have medical doctors who's family practitioner. We have several nurse practitioners who are family practice and background, so we can help manage the general family type of diseases or health-related issues.
Okay.
And we have specialized degrees. We have pain management doctor. We have chiropractic doctor. We also have a nutritionist on staff, even acupuncturist on staff that can do those things. So we can, being a Asian, being a Chinese descent, I kind of believe the best healthcare system is to take the Western medicine combined with Eastern medicine concept and put them together. There is a right place for Eastern medicine and there's a right place for Western medicine.
Right.
When you combine them together, you can utilize both of them on a person who needs both at the same time.
Absolutely. And the ending goal, what it sounds like for yourself, doctor, is to get the person back to their normal state and better. So I know we have a lot of guests on the show, but most of the goal is you guys. Those of you guys that are watching right now, that is the goal, to get you back healthy.
Right.
So he definitely has a setup in place to get you guys in the right direction of being healthy. So I want to continue and basically tell you guys to open up those lines of communication. If you guys have any questions for Dr. Sammy Tao, I know I have a few right now that I'm going to go ahead and ask Dr. Sammy Tao, but Dr. Tao, Rebecca is on right now. So hey, Rebecca, she's asking, what type of therapy do you recommend post-knee surgery?
Well, post-knee surgery is to help. The primary focus of post-knee surgery is to get it healed as correctly as possible. So because the knee, either partial, total, or microscopic surgery on the knee, those will determine how long the recovery time will be.
Okay.
However, everything should be focused on minimizing scar tissue formation and restore the flexibility and the strength to the knee joint. In our office, we don't just focus on the therapy for the knee itself, because the kinetic chain related to lower back, the hip, and even the ankle down to the foot has a lot to do with that side. And then you want to do bilaterally. So you want to build that correct movement, the kinetic chain, as quickly as possible and minimize the scar tissue formation. It is really critical to get back to the therapy quickly as possible, because you can minimize the scar tissue formation. Scar tissue is not flexible. It doesn't behave the same as the muscle, the tendon, and the skin. So you want to minimize that formation.
So I know, Rebecca, you were asking what type of therapy recommended. It sounds like it depends on what type of knee surgery there was. But what I got out of that, doctor, is everything is a connecting factor. So if this is the problem, there's other things leading into this problem that you also, as a doctor, need to focus and also not neglect.
That's correct.
Right. So Rebecca, definitely let us know what type of knee surgery, and we can also get you in contact with Dr. Tao at Texas Regional Health and Wellness. I know that phone number will be located at the bottom, but just in case, if you want to let the viewers know that phone number so that they can reach you as well.
Sure. So our main number is 281-208-7335. We also have a Chinese line. So you only speak Mandarin, or you need somebody to speak Mandarin, you can also call 832-998-2416.
Awesome. So that contact information is on the screen as well as in the comments, just in case you guys have a need to kind of get a little bit more of those services. So we do have another question coming up from Martin. This one's a little bit longer question. So, hey, Martin, he's saying, if my family member has had back pain the past couple months, but is scared to visit a chiropractor, what do you suggest could help her?
Well, first of all, being a chiropractor, I do get that question all the time. And I think just because of we have so much social media and so much information out there, that fear does play into people. Mm-hmm. Just like any doctor, there's good doctor, there's bad doctor, there's good chiropractor, bad chiropractor. Just because somebody had a bad experience with one doesn't mean all of them are bad. I mean, over millions of patients, people in a year seeing chiropractor. So they are experiencing a great deal of benefit from seeing chiropractic. Mm-hmm. So I suggest just find a good one. Mm-hmm. Your gut can tell you if you and that chiropractor is going to get along, and somebody who knows what they're doing. You feel comfortable with it.
Right.
No difference than any doctor. No difference than if you're using a plumber, right? You're going to have to interview several plumbers, find the one that you're most comfortable with. You check their credit, check their work history, and most importantly, talk to them.
Yeah.
So I've always tell other people, when you want to go visit a chiropractor, call them up and talk to them.
Yeah.
Or maybe just go by their office, make an appointment, and see how comfortable you are with the person. Your gut feeling is pretty good, telling you whether you're seeing a good one or not.
Yeah, I definitely agree with you, because I know what I can relate to is hair services.
Right?
I have had, natural curly hair. I've gone in and I'm like, okay, this is what happened to me, and I just kind of communicate. That communication definitely helps that professional, whether it is a doctor, a health stylist, or a hairstylist, or even a plumber. You never know. That helps them kind of gauge, okay, see where they stand. Same with my doctors. I do the same thing. Just because of what you say, overly communicating is better, because that way you can kind of get a feel. I think that's very important. But people in the past probably have gotten burned. I mean, look at what the social media has done. I mean, some of it is negative and some of it is positive, but we should definitely reach out to those doctors. I mean, even if it's a specialty doctor that you just might not know where to go, giving Dr. Tao a call, I'm sure you can make some recommendations of some good doctors that you may know that might not be in your area or under Texas Regional Health and Wellness, but that you can recommend if it's a different specialty doctor, let's just say foot, or I don't know, just throwing it out there.
Right. So I think social media had made a difference also in holding doctors responsible for what they do. So because everybody gets to leave a review online, right?
Yeah.
So, and no difference than when I go to a restaurant. Before I go to a restaurant that I don't know anything about, I read about a review. What did people say? Are they getting a good service? Are they providing good value for what they do? And same thing. So now anytime you go visit a family doctor, a new dentist, a chiropractor, read about what the public has said about them.
Yeah.
Before you go in, that gives you a really good gauge.
Yeah.
So it's
good.
weeding out those doctors who are not doing the right thing nowadays.
Yeah.
So that's good.
I love that. That's a good suggestion. Reading the reviews and kind of seeing the average, the good, the bad, because there's going to be bad reviews out there, as you know. But that is very important. That could be your first gauge. So Martin, as far as for that family member, it sounds like yes. So the suggestion is definitely seeing a chiropractor, and you guys definitely suggest if it's not starting off with chiro cares, maybe you guys kind of see where the client should go.
Sure.
So it's definitely recommended to visit. First of all, starting with somebody.
Right. Find somebody who knows what they're
doing.
The most important part, I think, it doesn't matter which specialist. The doctor should be able to tell you where it's coming from. Why are you having back pain? We always believe in our office we do the same thing. We properly diagnose the patient where it's coming from, because once we know it's coming from, then appropriate treatment, whether it's medication, therapy, chiropractic, surgery, becomes the appropriate solution for that. What I really don't like is try this. If it doesn't work, let's try this. But what's happening to me, nobody knows. So then you're really just shooting in the dark, hoping to hit something.
Yeah.
So that's not the right way, I think. It's wasting time, wasting money, and could potentially hurt somebody.
Yeah.
So the provider, whoever you see, whichever specialist you see, they should spend the time to really figure out why you're having back pain. and then appropriate recommendation to address the why.
That is good, because I know a lot of people probably watching. We go to the doctor to get better, to
Right.
find the reason what caused the neck pain. Well, you're gonna look down the arm or whatever you guys do, or what's causing my headache. There's something on here
There's
that's
something on there.
causing it. Isn't
Exactly.
that crazy?
Right.
So we're gonna go ahead and move on to the next question. So I have Chris. Chris is saying, I have 2 herniated discs,
Okay.
and the pain comes and goes. The pain shoots down my leg. What do you recommend I do, or who should I see to get closer to being back to normal?
Okay, so I heard too many times herniated disc to be a too loose of a term.
Okay,
So,
let's explain that, huh?
So there are actually various grades of how far a disc has come out from its space. So if the disc comes out just as slightly, that's usually termed as a bulge. So slightly could be 1 millimeter, 2 millimeter, or 3 millimeter away from where they're supposed to be, and that's a disc bulge. Anything more than 3 millimeter, that's what we begin to really call it a disc herniation. So on a small scale, therapy will be perfect to get those discs back into proper location, and also decrease the inflammation it causes. When it becomes more than 3 millimeter, get closer to 7 millimeter, now it becomes a much further out herniated disc. Now you really are pushing on the nerves. That's when patient really complains of radiating symptoms. Typically, for the lower back, will pass the knee. For the neck, will go down to the fingertips and so forth. So now these are a little harder to treat because they're so far away from them. So look and see what are the proper ways. I've always believed, and most recommended in the medical society, is to do conservative care before you have surgery. So conservative care, decompression therapy, physical therapy for the lower back, chiropractic care, anything that could help reduce amount of disc herniation will really help alleviate the symptom. And so if that helps, then great, that's a great way to manage it. If it doesn't, then yes, we may have to look at some sort of surgery to help alleviate that disc herniation.
So you were just talking about there's different levels of herniation, and I know you were talking about the numbers. So the higher the number, the bigger the herniation
That is correct.
Okay. So if it's a big mass number or herniation, is there a way that an 8 could go down to a 3, or once it's that big, it kind of like the next option surgery?
Well, it depends.
Okay.
So this is where doctors really who knows about how to treat disc herniation really knows what they're talking about. The reason is it depends on how long it has been there, because when the disc is herniated for a long time, scar tissue sets in. The tissue properties start changing. It's no longer a disc material that can be flexible.
Wow.
So if that's the case, then reduce it back down to 3 or all the way in, nearly impossible.
Oh, I see.
So this is the reason why we tell patients when you have back issues, get them looked at sooner, because longer it is out there,
The
harder, worse to get treated for. So don't wait, because every time it's changing. But if it's just something that happened fresh, there's a really good chance it's going to return because it just happened and the tissue is still fresh with no other pathology with it. So that's the reason MRI gives us a really good idea of what's going on in that area and how we can do. Now, we partner with back surgeons a lot just so that they can help reduce, and then we can do therapy to help maintain and build your body stronger to be able to take care of that area.
So it sounds like you guys also do post-surgery as well.
So yes, we do post-surgical rehab. So after surgery, it's really important to do rehab. A lot of research now points to that for patients to have the best outcome possible, even with for the surgical patient, really is to do therapy beforehand and then to do therapy afterward.
Okay.
So that's the best outcome.
Okay. Well, that was a great question from Chris. Sounds like there's just a lot of scenarios on it. I do have a couple live comments. This is from Chriselle saying, do you guys have any locations in San Antonio?
Currently, we don't. So
He
maybe
said
we will.
currently.
Maybe we will in the future.
Yeah.
But right now, we're
Okay.
servicing Houston area.
Okay, perfect. So in the Houston area, Elise is giving us a thumbs up. So thank you, Elise. And then Ramesh, our partner, managing partner here of D. Miller and Associates, Ramesh Raguthaman, he's saying, hi, Dr. Tao.
Hi.
Very glad to have you part
Thank
of our
you.
program.
Thank you.
Thank you. So thank you so much also for being here. So we kind of got into the herniations and all of that good stuff, which is a lot of great information. I know we'll probably have some visuals here shortly. We have another one from Laura. Laura is saying, what is the difference between a bulging and a herniated disc?
Oh, okay. So the bulging typically is just slightly away from the area. Study shows actually majority of people have what's called a slightly bulged disc, and we're remaining asymptomatic, no symptoms, no feeling about it. So, but everybody's different. So you could have a slightly out disc, which is like the picture shows. It could cause you a lot of pain, whereas some people have no symptoms. So that's really hard to gauge how bad it is. But when it goes too far out, then we're now into what's called a disc herniation. Disc herniation, now the disc starts going into where the space where the nerve travels out of the out of the canal and goes into the muscles and the areas.
So the muscles, the areas, the nerves, all that will cause shooting, radiating pain, all of that. That makes sense.
Right.
That definitely makes sense. I know you guys are seeing the visual right now on the screen. So let me ask you, Dr. Bulging disc, because I just asked you about the herniated disc. That one can come back into the spine and go back to its normal state?
Bulging has a really good probability to go back.
Okay.
Because it's not far that much. When you start becoming a herniated disc, that probability decreases quite a bit.
Okay.
So it's not impossible, but every case is varies.
This is amazing information because I know when some people go to the doctor and hear these terms, they might not have the explanation, or you are in such high pain level or you're scared that you're really not listening to the doctor.
Right, sure.
I hear the doctor, but I don't hear it because I'm going through so much pain.
Right.
So this is awesome information about bulging discs and herniated disc, which that visual, again, is online. We have the live comment from Chriselle again. She's saying that this is such great information. Thank you, Dr. Tao and Madi. So
you're welcome.
it's working.
That's
so
right.
Thank you
We're
so
here
much for watching. Feel free to keep asking those questions. Open up those lines of communication for Dr. Tao. So now I know we are talking about bulging herniated disc. Anything else about the spine that you might want to add to our viewers that might be either beneficial or important? It's all important, right? Because that's what controls our whole movement. But anything that you might want to tell our viewers that you want to leave them with.
Right. Well, I use joint health, that's particularly in the spine, very similar to your teeth. So when you begin to feel pain in your teeth, that typically speaking that your teeth is rotten, and it's going to rot in a certain amount of speed. Your spine, when your joint, when it starts hurting, they're also rotting it out. They're deteriorating, they're wearing itself out. So there's a certain amount of time. You would never just keep taking pain pills, ignore the tooth pain that you have. Why would you keep taking pain pills, ignore the joint pain, the back pain, whatever pain you have, allow it to continue to deteriorate? The problem with so difficult to treat back pain is because most of the time, everybody complains we're too busy. I got things to take care of. I got my family to take care of. I gotta work. I gotta make money. I can't take time off. So continue to kind of put it off. Use things to put it off as long as possible. Then by the time you have time to come around, maybe a little too late to do things that are conservative. So there's no difference than toothache. As soon as you have them, you should get it taken care of. Sooner you get it taken care of, less the problem you're gonna have, and sooner you get it taken care of, generally less cost.
Yeah, for sure. So that's an amazing analogy, and let me tell you why. Because I can relate. Once you go, you need to get a cleaning, so you have your maintenance. You get a pain or a cavity, you have to go get it fixed. Like, we don't hesitate with that, and we should treat our spine or even our body. Let me just take it a step further. We should treat our body the same way. That's an amazing analogy. I want you guys to take that very seriously as far as if you guys have any back pain, there is a cause for it. Something may have happened, whether it's a muscle, whether it's a pulling, whether it's scar tissue. sky's the limit, it sounds
Right.
like, of what you, but it's your job,
Right.
right?
I tell patients this all the time.
Mm-hmm.
They said, well, does that mean every single problem that I have, I should go see a doctor? Well, body's very good at self-healing. It could be that you over-exercise, you overdid something, and it caused you to be discomfort. But the rule of thumb is, if something doesn't go away in 3 months, it keeps resurfacing more than 3 months, it could be potentially something that's not good. You should always go see your doctor to get it checked out.
Yeah.
Doesn't matter if it's back pain. If it keeps coming back, it's coming back, and more than 3 months, you should go see somebody and get it checked out.
Absolutely, absolutely. And back pain, I don't know if you guys have ever experienced back pain, because I have, and I did lower back pain. It is no joke. Like, you literally cannot do your normal day-to-day, and you're like, wow, I didn't know how much I use my back. You can't walk, everything hurts. It just takes you out. It's terrible. So definitely recommend taking Dr. Tao's recommendation is very highly advisable right now. So we're going to switch it over a little bit right now, Dr. Tao. So you did mention that Texas Regional Health and Wellness also does something called stem cell.
Yes, I think it's like a buzzword at this point, isn't it?
Buzzword, right?
Everybody's talking about stem cells. Why is that so popular, and why is it basically sweeping the nation by storm?
Yeah.
Well, this is by far the first time that we can heal something from when it's broken. So it's going leaps and bounds, and I forgot which provider said it or where is it coming from, but they said this is the way it's going to change where medicine is going for the future. The reason is stem cells can now be harvested, taken out and put it in your body and my body and let it regenerate. It's just the technology is going leaps and bounds. So that's why it's such a big buzzword, because now the biggest problem with anybody is that when your body part is broken, we don't have a replacement part. Mm-hmm. So when you wear out a liver, you're done. When you wear out a joint, you're done. So now for the first time with stem cells, there's a chance that we can rebuild without using artificial parts. So that where it's going, I don't know where it's going to go for sure, but it looks like we may have replacement parts soon.
Okay, that's I want to hear more about the stem cell process, what you guys do, what exactly it entails. So we all have cells in our body, right? And some of them fight each other, some of them go bad, is what you're saying. Mm-hmm. And then you kind of put a new set of, kind of like batteries, a new set of batteries in there. I guess you could look at it. So what is exactly that you guys do in Texas Regional Health and Wellness?
Okay, so I just explained it in the way that most people can understand, and this is not a medical terminology, but stem cells is something that your body has already, and it's producing all the time.
I see.
So in your bone marrow, your body is producing stem cells. Stem cells is a beginning form of cells that has all your DNA, and when it travels to the appropriate places, will express itself to become whatever cells that your body requires. So when a stem cell goes to the hair, it becomes hair. When it goes to the skin area, it becomes skin. Your body's regenerating, replenish all the time. The problem is, as we're aging, the number of stem cells is dramatically decreasing. So that's the reason we don't heal as well as we do. So if you look at when you're 50, 60 years old, there's no way you can be bouncing around like when you were 10 or 20 years old, because your body doesn't heal up like that. And so as we get older and older, now the bones and the muscles and not going to be able to be as good as when you were a teenager. It's a lot of time due to the fact that we're aging. Part of the aging process that your own stem cells is decreasing. Wow,
that's awesome to hear. That after, is there a certain time period or age to where I'm sure different scenarios and situations will call for a stem cell, but is there a certain age that you would recommend if the body's just not responding how you want?
So right now, according to the usage in the United States in the medical field, is that the stem cells can be used to treat osteoarthritis, which is the joint degenerations. So in various areas that are commonly being used, knees, hip, lower back, fingers, elbows, anywhere that shows a joint degeneration, that's an approval area. And there is now a lot of research being done on using stem cells in the autoimmune diseases, such as fibromyalgia, such as lupus, such as Hashimoto, in that sense. So right now, that area is still having a lot more data and research coming out.
Okay.
And so we begin to know more what it does for the body. But right now, it has a really great data promising for helping with osteoarthritis. Osteoarthritis is the end stage of wear and tear in a joint. So that's where any doctors gets frustrated in terms of osteoarthritis, because now your joint wears out, it won't function like it's supposed to. So how do we get it back to functioning? So we used to have a lot of artificial parts to replace, artificial knee, artificial hip. Now there's some stem cells can help regenerate. Now stem cells still has its own limitation. It doesn't go, I tell patients all the time, it doesn't go you take your joint from 0 to 100. It doesn't. So you still have to take care of your body, and you can use stem cells to help regain some of that regeneration. But that's going to go further. More the research and usage out there, more that we know what to do with them.
So it doesn't make you 100%, but it does help the process as long as you're also the person doing the steps that the doctor's recommending.
That's correct.
So
awesome. In our office, for example, if a person comes in with a knee pain and it's due to wear and tear and an osteoarthritis, so they are recommended for stem cells in our office, but we also look at it to see if that person's overweight. Because a lot of times when you're overweight, you're unhealthy, you really accelerate the joint and wear and tear. So do we want to just put stem cells and send you home and you continue to live the lifestyle you have?
Yeah.
We would advise you on lose weight and how you can preserve this wear and tear again. And that makes your relief from the stem cells a lot longer.
And like you just said right now, if someone's overweight and they need to change their lifestyle, you also have that in-house.
That's correct.
That
so
you can recommend.
Our office offers medically supervised weight loss.
Awesome.
So use the medical technology to kind of help patients to start. But one of the main thing we do is our nutritionist helps with meal planning, eating better, and with a person. So that you not just lose the weight through the medical weight loss, but you also be able to maintain the weight because you've been taught how to eat better, how to maintain your lifestyle. And most of the people would be able to maintain a healthy lifestyle if they're partners with it.
Right.
So that means either your husband or your wife or your significant other are doing a similar lifestyle, but when you're doing the changes, you may not have the support you need. We're here to support them.
That's
so
awesome.
Our nutritionists, our staff helps support the person until they're able to have their support system themselves.
So again, I'm going to say the contact information is here on the screen. So if you guys have a need for, even he just mentioned nutrition, lifestyle change, if you're not able to lose weight, you need help, you need support, they also do that at Texas Regional Health and Wellness. So make sure you reach out and make sure you ask for Dr. Tao so he can guide you into those steps. So I'm going to go ahead. Paul has a question. Paul is asking, because I think he sees that we're talking about stem cell. What is the advantage of stem cell, and how does it differ from like your day-to-day pain management? I got in an accident and got a cervical injection.
Okay.
So I don't know if this is something you
Sure.
recommend that might help for Paul.
Stem cells really comes in when there's damage to the parts, not just the regular sprain and strain, because your body can heal sprain and strain pretty easily. But let's say you have a herniated disc, or let's say a cartilage in your knee that the meniscus has a tear in it. That's really difficult to repair. So surgical repair or any kind of medication injection helps decrease the inflammation in that area, hoping to function as long as possible, provide you the relief you can. Then stem cell kind of goes a different way. Stem cell comes in, could help healing, promote regenerations from the body through natural means. So there's to some extent that meniscus can heal itself. And obviously big tear is going to be very limited, but small tear and some wear into the meniscus can help regenerate. So provide person the function and the pain relief they need. So in the example of what Paul is talking about in the cervical, typically in your cervical injury, you would be doing anti-inflammatories, any kind of medication that helps decrease the pain and inflammation in that area. Well, stem cells itself has a great deal of anti-inflammatory effects, so that's what it does. So as the stem cells goes in through the repair and heal, then it will automatically help the body decrease the inflammation in that area, thus decrease the pain. Pain is always the byproduct of something that's wrong.
Right.
So as you heal what's wrong with it, the pain will go away on its own.
Right. So it kind of sounds like it's like stem cell therapies in a way. So, and what type of stem cell therapies, if you want to talk about that, because I think we have a visual here on those stem cell therapies, so that Paul can probably kind of get a little bit of an idea of that.
Sure. So here's the terminology on stem cells. Most people think stem cells is stem cells, but there are different kinds. By the FDA rules of terminology is that it has to be live nucleated cells. So there are two types of live nucleated cells. One is coming from your body, so it's called autologous. So from spinning down the fat through liposuction or extracting out of bone marrow, you can get your own stem cells out. And so that's one type, your own stem cells, and we inject it back in for therapy. The other one is coming from donated umbilical cord blood stem cells. So now in the United States, it is allowed now to extract stem cells from the birth of a baby, the cord blood that's left over, to extract the stem cells for medical use. So that's one. So those two types are live nucleated cells. The cells coming out of amniotic fluid, placenta, they're not live. However, they have good healing power. They're just not live nucleated, typically not lasting as long for the healing effect of a autologous stem cells or donated umbilical cord blood. Now, if you're doing enough research on internet, you're going to find a lot of big controversial using stem cells. The controversial, if you read it, is really something that's not legal in the United States. It's something that other countries that try to get stem cells out of aborted babies. So that's not something that's viable. That's not something that's clinical usable, and definitely illegal in the United States. So when you're reading something about controversial, just pay attention. That's kind of like where it's coming from. Okay,
well, that's great information. You kind of just had me thinking here, doctor, but is there any cons to using stem cell, whether they're minor or not, that you can probably think of?
Just like anything, the con would be you pay for something that didn't work for particular your problem. So there is a cost associated with it. As far as the relative risk is much lower in comparison to other surgery or in procedures. Most of the time, the stem cells are injected into the body into the joint. And so injection has a certain amount of risk associated with it. No difference than any other injectable that's used out there. Other than that, the risk of infections, things like that. Now, at this point, there's no research out there shows that there's rejection for stem cells out there. So the risk of rejection from stem cells is very minimal and unknown out there.
So it sounds like the cons would be how you would just any other thing like a needle or like injecting
the risk associated with
that. The risk associated with that, which it's stuff we've kind of seen out there, but nothing with the actual stem cell that as of yet, or that has been reported or anything like that.
I mean, just like anything, there's a risk of infection. So we do have to tell patients, hey, you're getting stem cells injection. It is something that's injected in your body. One of the things we have to disclose with you is possible infection. But any reputable clinic should be doing a clean technique that will minimize the exposure to the patient.
Awesome. So I have another question. We're still on the stem cell. This is Riley is saying, what does the stem cell treatment plan look like? How frequent?
Oh, great question. Stem cells, just like anything, is dosage dependent. So that means bigger the area, more stem cells is needed to help heal and regenerate for that area. So the dosage determines how much it costs. Now, like I said at the beginning, it doesn't regenerate from 0 to 100. So how much regeneration relief it gets for a person really also person dependent. So if you got right about enough dosage and in the right area, most of the people find that one shot is good enough that they can live a normal life with minimal or no pain at all, and they can do the exercise, the movement
Wow.
they want.
Okay.
Now, for those individuals did not get that fully satisfied, they can also elect it to have more. So that's another option. And then that's really up to the individual. So it's up to the patient. We tell patients after you had it for a while, then you look and see how much relief it's giving you. If it's not good enough, maybe we ought to visit to see if we need to put in more and when. If it's good enough, great. Just preserve and take good care of yourself.
Right.
Make it last as long as possible.
Wow, that's a great question from Riley. So thank you, Riley. Great answer too. It's really bringing us, the viewers, and myself aware about what the stem cell can do, what its uses are for, the types of therapy. This is great information. I know our viewers also have a lot of questions that have arose. I have 2 right now pending. So Carmen, hey Carmen. Carmen's asking, how soon after stem cell treatment will I start feeling relief?
Great question. Once again, it depends. It depends. In our office, most patients reported a significant decrease in around 4 to 6 weeks time. It seems like that's a sweet time to where the body has healed enough to where the symptoms subsides quite a bit for them.
Right.
So that's what we get reported. There's no guarantee that very next day that you're going to be pain-free or symptom-free, but we got quite a few people let us know that they were completely pain-free the next day. Not all results are like that typical. Everybody varies. It's really hard for any provider to kind of predict which way you're going to be. The rule of thumb would be bigger the problem, longer it's going to take to get that complete relief. Smaller the problem, sooner you should see a relief.
See. So on average, it sounds like 4 to 6 weeks, rule of thumb, on average, but it also depends. You guys hear me say this on the show all the time. Every case is different.
For sure.
Whether it's on the legal side with D. Miller Associates, and even here, every case is different. So if it's smaller, it might have a sooner recovery time.
Right.
If it's bigger, different story, right?
Right.
Awesome. Well, that's a great question. So thank you, Carmen, for that question. Next question that I have also pending is Whitney. Whitney is asking, this is a good question, doctor. What's the estimated cost? Would my insurance cover the stem cell? And do I also pay for facility costs?
Well, great question.
3 questions. She got all her questions. She said, let me do this.
See if I can remember all of it. So let's start with the last one. Currently, we have not found insurance to be covering for it.
Okay.
I think it's just like any procedures. When there's new medications out there, new procedures out there, insurance aren't the first to jump in to cover for coverage.
Yeah.
For whatever reason it is. I can't speak for the insurance company.
Right.
So right now, they're not looking at it. Now, as far as costs, even covered services by the insurance company, we all have deductible co-pays now. So even a surgery that's covered by insurance, we still have out-of-pocket for that. So what we have found is that most of the stem cells, even though it's not covered by insurance, is still less or about the same as your out-of-pocket for a surgery.
Okay.
So that means, hey, whether it's covered or not covered, you're going to pay for it anyway, and it's about the same.
Yeah.
And most people like to try stem cells for the fact that, just like I said before, conservative everything before you have to have that surgery done. If the money or finance is permissible, try it. See if that gives you the relief you're looking for. If it doesn't, well, we still have to look at surgery. However, if there is a relief, that means we can put off surgery for a longer time. Technology continues advancing. What we can do in healthcare continue to advance. So what we can do now will be vastly different from what we can do next year.
Yeah.
So I always advocate if we can put it off as long as possible. You don't know what's going to come in down the pipeline as far as medical technology. So that could be a big difference. How much it costs, it also, once again, cell dependent. So where is the area? In our office, we kind of lump it into one package deal. We don't charge patient extra for the facility or the procedure. We can, it's just like, everything's included. You're never going to get a counter bill. From anybody say, hey, you owed us this much for that procedure, you're done.
Right.
We make it once together.
Okay. That's awesome. It almost sounds also to a lot of things. Insurance doesn't maybe cover it now, but you never know what the future holds. They might cover it next year or 2 years from now. You never know. What is the estimated cost? It almost sounds like if it's going to make you better, you're going to get relief, and it's you're not putting a foreign object in your body. It's almost worth it, in my opinion. I mean, different people will have a different opinion, of course, but in my opinion, it sounds like it's definitely worth the cost that you will endure, that out-of-pocket cost.
So right now, with the research and the clinical evidence showing that the success or to achieve what people are looking for, it has a great high percentage of achievement for what you're paying for. I think most of us, just like me, we want to pay for something that will do what it's supposed to.
Right.
If it doesn't, you feel like you're wasting money. Well, in healthcare, there's nothing with 100% certainty. Even surgery, even medication, with chiropractic, with therapy, nobody can say with 100% you're going to get better. Well, we're always looking to see something with a high percentage success rate. So if you can show high percentage, every individuals have certain willing to pay for that higher chance of getting relief. And we see that all the time. We see the clinical relief in our office all the time. It's very emotional for those who are looking for that relief.
Right. So it sounds like it definitely is worth it, but that assessment needs to be done by yourself, that one that is going over or experiencing the stem cell. I have time. We're getting close to the end of the show for one more question. This is Naomi. Naomi's asking, how would you know someone is a candidate for stem cell therapy?
A great question. So let me just kind of give the basic premise. That's what we do in our office as far as stem cells. You have to have the parts that needs to be rebuilt. That's where stem cells will do the best. So if you have osteoarthritis, stem cell does well for that. Tear, injury causing the parts to break apart, stem cell does well for that. So that's what we kind of screen for. If you don't have those things and your pain is coming from some other things, then stem cells probably not going to do that. So I would say for all the cases coming to our office looking for different relief, half of them will tell them, hey, stem cells will work for you. The other half of it will tell them, no, it doesn't. You really need to do something other than stem cells. At our office, we're very honest with the patients. If it's going to help you, do it. If it doesn't, we're going to tell you, no, don't waste your money in that area.
Yeah. We love transparency. I know you guys, the viewers, also love the transparency. We always try to bring someone to also educate our viewers. I know we talked about that before the show. Education is so important because if you guys are able to know a little bit more and be a step ahead, if this happens to you guys already got the knowledge from Dr. Tao.
Right.
Exactly. So we do have a couple comments. It's from Christian saying hello. So hey, Christian. And then Ramesh again. He's back on Attorney Ramesh Guthaman, Madi B, and Dr. Tao. Excellent and informative show. So thank you. There's a lot of people watching right now that they are really listening and really grasping this. If you're catching the show at the end, it is okay. You can watch the show at any of our other social media engines. So we do have YouTube, we have Instagram, we have Facebook. You can watch this show on our YouTube channel, Talk to Me Tuesday on a Tuesday. So just in case you missed it, you can always rewind. If not, you can always send it to a family member or a friend from YouTube. So now I want to talk a little bit about the holidays. The holidays are coming up, guys. So I want to ask Dr. Tao, what are you guys going to do, or what does your family do generally on Thanksgiving?
Well, being a Chinese-American descent, we do a hybrid.
Oh,
so in our family,
that's
I cook the turkey because I love traditional Thanksgiving dinner.
Yeah.
Then we kind of mix with some Chinese food with it, so we have a
I
hybrid.
love that.
Yeah.
I love that.
And then I also go in the tradition of go shopping on Black Friday.
There you go. Oh,
I don't
Lord.
need anything, but...
How early are you going to wake up? We might have you on our posting there. How early do you guys get up?
Well, I don't stay overnight, but... Now they open earlier.
Yeah.
So once we're done eating, we kind of go out and just kind of walk around and hang out with the crowd. And, and I don't fight the crowd for TVs or anything like that. But we kind of go shopping and kind of walk around as a family.
Get the food down, right? Get that exercise and that cardio in.
Exactly. Watch the football.
Yes,
and
there
such,
you go.
So we enjoy family time.
That is awesome. And I love what you guys do at your home, the tradition of a hybrid Thanksgiving. That is awesome. And still incorporate what the American life is, so that way, I mean, the kids, upbringing of the kids, I mean, they see it at school and stuff, but it's super awesome to have also some of your culture's dishes there as well. What is one of your favorite dishes that you make from your culture?
Well, I'm not a very good cook.
Uh-oh.
So I don't have any delicious dishes to show you, but I can cook one very good fried rice.
Oh, wow. When I asked that question, that's what I was thinking about. That just sounds so delicious right now, is fried rice. So, hey, I'll take that answer for sure. And it seems like it's going to be cold for Thanksgiving here in Houston, Texas. And other places up north, they already experience the cold. But for us, it's not common for us to get cold weather this early. So make sure you bundle up, Buttercup. So I want to thank you, Dr. Tao, for being on the show. If you want to leave our guests with one more comment or one more quote, what would you leave our guests with to either utilize your services or just to be a healthier lifestyle?
The advice or quote that I would say is, pay attention to your body. Your body does tell you a lot of things. Don't ignore it.
Yeah.
Because no difference than your car. If you have a check engine light on or it's making funny noises, those are clues that there's something wrong with it. Get it checked out as quickly as possible.
Absolutely.
Most of the times that we run into the critical care, whether it's pain or heart attack or whatever it is, it's because we ignored it way too long.
Yeah.
So don't do that. Problems are much cheaper and easier to fix at the beginning than is late, regardless if it's covered by insurance or not.
Yes.
What'd you say?
Yes, I agree. So pay attention to your body. That's a great quote. That's a great suggestion. Pay attention to your body, that the signs that your body is giving you. Because if you're feeling something, that means something is alerting you of something. So your health is important. You guys are important to us. So that's great comment. Again, the information for DMO and Associates as well as Texas Regional Health and Wellness is on the screen as well as in the comments. So if you guys have any additional questions for Dr. Tao, he's also tagged on this. So you can follow his social media as well, and you can reach out to him, direct message directly to him. So thank you again for being on the show on Talk to Me Tuesday. I want to thank all of you guys for being on the show here, sharing the show with all your friends, and making sure that other people also can live a healthy lifestyle. Until next time, thank you for being on Talk to Me Tuesday. Bye.